Mute. All right. How do you get to the? Yeah. How do you get to the mute? PowerPoint. All right. How do you get to the? Yeah. How do you get to the mute? PowerPoint. All right. How do you get to the? Yeah. How do you get to the mute? Thank you. And welcome to today's annual Fall Prevention Awareness Day and Prevention presentation. My name is Stanley Daniel. I'm the Director of Rehab here at Care One. Thank you. And welcome to today's annual Fall Prevention Awareness Day and Prevention presentation. My name is Stanley Daniel. I'm the Director of Rehab here at Care One. Thank you. And welcome to today's annual Fall Prevention Awareness Day and Prevention presentation. My name is Stanley Daniel. I'm the a lot of feedback.
Is your phone
I
on?
turn it off.
Okay, yeah, it will work.
Okay. Can you just make sure the presentation is on?
Yes, yes.
There's a lot of feedback.
Is your phone
I
on?
turn it off.
Okay, yeah, it will work. Can you hear that?
Okay. Can you just make sure the presentation is on?
Echo. Yes, yes. Is your phone on?
I turn it off.
Okay, yeah, it will work. Can you hear that?
Okay. Can you just make sure the presentation is on?
Yes, yes.
Is your phone on? I turn it off.
Okay, yeah, it will work. Can you hear that?
Can you just make sure the presentation is on?
Yes, yes.
Is your phone on? I turn it off.
Can you? What happened? It's okay.
Can you just say something if I can hear you?
Testing. 1, 2, 3. Testing. 1, 2, 3. Testing. 1, 2, 3. I see a thumbs up. We are better.
Yeah, perfect. Don't put the sound.
How do I get to it?
Okay, go back there. Okay, and then when you want to do the share, that's it. Okay, good. You're good to go.
All right. I apologize for that hiccup. Hello and welcome to the annual Fall Prevention Awareness Day presentation. My name is Stanley Daniel. I'm the rehab director here at Care One at Ridgewood. With the help of everybody here at our lovely facility, I'm here to help present the information today on falls prevention. I'd also like to thank AOTA and APTA and the American Geriatric Association of Physical Therapy. Many of us want to know, are falls preventable? The simple words, "she fell," have a huge impact on us. We all know someone who has had a fall and experienced significant life changes, but are falls preventable? The good news is yes, falls are preventable with simple measures. Today's discussion, we are going to talk about a fall and fear of falling and their impact on us. We will also talk about what makes an older person more at risk for falls. These are called risk factors. We will also talk about action steps you can take to reduce your risk of falling. So, what is a fall exactly? Landing on the ground or some lower surface when you didn't intend to is a fall. This includes slips and trips. Accidents that cause you to fall, for example, getting run into a scooter, falling, getting hit by a shopping cart, these are not considered falls. You do not have to land on the ground to have fallen. For example, if you stand up from a chair and lose your balance and fall back into a chair, that's actually termed as a fall. Have you had a fall in the past year? Were you hurt? Do you worry about falling? Do you feel unsteady when standing or walking? As we go through the risk factors for falls, think about what might have been the cause of any recent falls that you have had. When asked, are you afraid of falling? Many people will say, no, I'm not afraid. I'm just more careful. A fear of falling is defined as a lasting concern about falling that may cause a person to stop doing tasks he or she is unable to do. For instance, if a person stays in most of the winter because of concerns about a slip on the ice, then the ice and fear of falling is limiting their activities and social interaction. This fear of falling is in itself a risk factor for falls. So why does a fear of falling matter to us? Well, it can stop a person from doing some of their favorite activities that are important to their mental and physical health. Legs weaken with inactivity. When we sit, we lose the muscles that we need to use to stand and walk and move. Inactivity leads to falls due to the change in muscle of strength and balance and coordination. It may make the person feel alone if they cut out the activities that are socially active, which can result in depression or anxiety. There are three main types of risk factors, and we talk about them individually. Most falls experienced by older adults result from the interaction of a number of risk factors. We don't have all the risk factors. We might have some of them. The physical risk factor. These are considered changes in the body that increase your risk for a fall. For instance, if you're inactive and you sit too long, then your legs become weak. Behavioral risk factors. These are things that we do or don't do that increase our falls risk. This could be taking greater risks like climbing a ladder to remove leaves from the roof and gutters, even if your age is 82 and you feel like you're 28. Environmental risk factors are a hazard in our home or community. Porch steps without a railing, a toilet that's too low, or a tub without grab bars are perfect examples. We all have different types of risk factors. Some we can change, some we cannot. We are all challenged to improve the risk factors we can change. We can become physically active, have our home environment evaluated and fixed, get our annual vision checks, make sure our medications are reviewed and considered for fall prevention, many different types. We can deal with the fear of falling through education, especially through evidence-based fall prevention programs that we will talk about later on during the presentation. We can increase our social activity. We can increase our exercise to improve any weak muscles. And we can learn to use assistive devices like a walker or cane the right way, the correct way. What can you do to prevent falls? Falls are the main reason why older adults lose their independence. The CDC's, the Center for Disease Control and Prevention, have a great brochure called Stay Independent. It focuses on 4 main things that you can do to prevent falls. Exercise to improve your balance and strength, have your doctor or pharmacist review your medications, have your vision checked, make your home safer. There are many different things to learn. What are our general exercise recommendations for you today? Well, first of all, always talk with your doctor or healthcare practitioner before starting an exercise program. Begin with PT or fall prevention classes. Be sure that the classes you sign up for are designed for your age group or your ability level, and have an experienced instructor help you. If it's your first class, let them know. Let your instructor know on the first day as soon as you arrive. If you find something that works for you, stick with it. Environmental recommendations. An important thing that each one of us needs to know is we need to reduce our risk of falls by identifying and eliminating fall hazards in our home. The CDC has a great brochure called Check for Safety. Many brochures are available that provide information on hazards to identify and to remove those hazards. For example, do you have any throw rugs on the floor? The general recommendation is if you have throw rugs, remove them or use double-sided tape so that the rugs won't slip. Overall, talk to your doctor about a referral to your local occupational therapist. Many home health agencies have OTs who are qualified to do a home safety evaluation. Medications can cause falls risk. Some medication side effects are that they make somebody dizzy, unsteady, or sleepy. Speak with your doctor to see if there's an alternative medication to help you avoid those side effects. Use your pharmacy to help you figure out the medication interactions, especially if you take 3 or more medications. Ask your pharmacist or your physician to review your medications annually and anytime there is a change to your prescription or over-the-counter medications. It's better to be safe than to be sorry. Vision and falls risk. It is very important to have at least one eye exam every year. If you have vision problems such as diabetes, glaucoma, macular degeneration, or other eye problems, you may need to see your eye doctor more than one time of the year. Your fall risk may decrease if you follow your doctor's eye recommendations to have cataract surgery, particularly if you're a woman. However, be careful. Falls can increase your cataract surgery due to the change in vision. Be extra cautious as you rehabilitate yourself back to your health. Blood pressure and falls risk. Have your blood pressure checked regularly. Speak with your doctor about how often to check your blood pressure. If you get dizzy when you stand up after sitting, see your doctor and have your blood pressure checked for postural hypotension. Some blood pressure medications increase your falls risk. Many blood pressure and cardiac medications will initially cause you to have some dizziness when you change positions. For the first 2 to 3 weeks after starting a new medication, be especially careful when you get up and try to count to 3. Don't start walking until you do this process. Chronic conditions and falls risk. All chronic conditions can impact falls risk in many ways. Diabetes might change the sensation in your feet. Arthritis can cause pain that can make you walk abnormally. Stroke can cause weakness in one side of your body or change your perception of the environment. MS, Parkinson's, and other neurological disorders may affect balance and mobility and increase your falls risk. Chronic pain might cause you to stand in a stooped posture or cause muscle weakness, which results in falls risk. Depression and the medications for depression also can cause both a falls risk. COPD or anything that changes your lungs capacity can also cause falls risk, making you dizzy when you move from sitting to standing and also losing oxygen to your brain as you become active. Be careful and speak to your provider about using oxygen during an increase in physical activity. Risk of falling may also increase changes in your medication, pain, lack of sleep, sad, worried, reduced activity. Your chances of falling may increase when you have a change in your medications. If you become sick or have an infection, if your pain level changes, it can also increase if you are tired or having ongoing sleep problems, or if you are sad, worried, depressed, or anxious. If you have had a reduced activity level or bed rest, your legs can become weak and increase your risk of falls. Fear of falling also contributes to the cycle of inactivity, weakness, and increased falls risk. With the new use of a cane or walker, there is also an increased risk of falls. Be sure to give yourself plenty of time to practice and use this new device. Every time you move to a new physical location, your falls risk may also increase. Learn your environment slowly, use the restroom on a schedule so that there are no emergencies, and move with good supportive shoes. Start small. There are many things you can do to prevent falls. Start small. Choose one risk factor to address and contact a health professional who can help you address it. Your pharmacist or doctor can review your medications to look at the side effects that may cause you to fall. There may be alternate medications that will work for you. An occupational therapist can do a home assessment and give you ideas to make your home safer to help decrease your risk of falls. A physical therapist can teach you how to use your cane or walker at the proper height and help with balance, strength, and the ability to walk safely. If a fall occurs, what should you do? Number 1, check for any injury or serious medical condition. Do not try to get up if you think you have a broken hip, leg, shoulder, anything. Call for help. Number 2, if you think you hit your head or know that you hit your head, seek medical attention right away. This is very important if you are taking blood thinner medication, since it may cause you to bleed in your head. Number 3, check the location for safety hazards, wet floor, clutter, lighting, unsafe furniture. Make the changes quickly as soon as possible so that you can decrease your risk of falls. Lastly, after the fact, you need to report whatever safety hazard you observed to the appropriate people that are helping you, such as a family member, maintenance, housekeeping, or other staff, in order to help fix the hazard so the fall doesn't happen again. Remember, move more. Your body will get stronger and fitter and have a decreased falls risk. Find something you enjoy and go for it. If you have any questions, please feel free to contact us here at Care One at Ridgewood. Here, we have some evidence-based resources for you online and have provided a number of pamphlets available through contacting us. We hope this is a good year for you in working to prevent falls. Thank you for watching.